Hello, 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 everyone. Welcome, welcome, welcome. Tonight, your Uncle Jim is going to talk to you about pediatric kidney patients and pediatric kidney disease. A couple of things I wanted to say up front. I'm not a doctor, I'm a patient just like you are. If you are a pediatric kidney patient or a pediatric kidney patient parent and you have questions, make sure that you address them with your doctors. I'm doing this tonight primarily just to raise awareness on the subject. I'm in the process of writing a blog, and I wanted to come on and talk to you and hopefully pique your interest a little bit about pediatric kidney disease and pediatric kidney patients. So, welcome to Kidney Stories. So, tonight we're going to talk about pediatric kidney patients. So, what's my story? How did I become interested in pediatric kidney patients? I became interested in pediatric kidney disease or kidney disease in children after a visit to Riley's Children's Hospital Dialysis Center in Indianapolis, Indiana. I had a friend that had a child that was doing dialysis at Riley's, and they invited me to come down and see for myself. And at that time, I was going down to IU Health in Indianapolis for blood draws once a month as part of my post-transplant care. The buildings between IU Health and Riley are connected, so in 2018, I visited the dialysis center at Riley's Children's Hospital. I was shocked to see in a very large room there were infants and toddlers in cribs and playpens undergoing dialysis. Riley's is the only outpatient chronic hemodialysis unit in Indiana for pediatric kidney patients, with an average of 30 children on dialysis at one time. Many of the patients and their parents there travel several hours for the 3 times a week, 3 to 4 hour dialysis treatment sessions. And after my visit, I was so upset, I had to put my head in between my knees for a while. I had no idea how prevalent the disease was in children and how it would affect me to see them going through some of the things that I had gone through as a dialysis patient and a kidney patient. I later learned that nearly 10,000 children are on dialysis in the United States or have a kidney transplant to treat kidney failure. According to the National Institute of Health, Black children have the highest incidence of end-stage renal disease compared to white or Asian children. In 2021, 57.3% of the children who started hemodialysis were Black, 40.5% were white, 22.2% were Hispanic. About one-third of the children receiving dialysis do so in an adult center. Because of my experiences, I've become much more involved with children with kidney disease. I did a broadcast with Emily Whitaker on her son Henry in November 28th, 2020. I have several Facebook groups that are dedicated to children with kidney disease, including pediatric kidney disease, children with kidney failure, transplant moms, children on dialysis, children with kidney transplants, child kidney warriors, children with kidney failure, Happy Mondays and support for Kidney Kids, and Kidney Kids Reunion 2022. I helped to initiate the Pediatric Kidney Patient Initiative called Kidney Pals with the American Association of Kidney Patients. So I'm a little involved in this. I was not a child patient myself. So that's a little bit about my story. So how do we define pediatric kidney disease? Pediatric kidney disease is defined as any kidney disease that affects children. It can be short-term or long-term permanent damage to the kidneys. There are two types. Acute kidney injury, a sudden decrease in kidney function that can be reversed in some cases. AKI can be life-threatening if left untreated, or chronic kidney disease, CKD, a gradual decline in kidney function over at least 3 months that can lead to permanent kidney failure. So, what are some of the symptoms of pediatric kidney disease? These symptoms would include swelling or edema in the hands, feet, face, or legs, urination changes in how often and how much a child urinates, including bedwetting at night, urine color, blood in the urine, which can appear pink or cola colored, protein in the urine, which can make the urine appear foamy, pain or burning when urinating, or bone pain, fatigue, feeling tired or weak, loss of appetite or poor appetite, weight loss or poor growth, pale or shallow looking skin, high blood pressure, which can cause headaches, chest pain, blurry vision and nosebleeds, repeated fevers. Other symptoms might include vomiting, nausea, irritability, stomach mass, hearing problems, and difficulty concentrating. Some common causes of kidney disease in children include both birth defects and family inherited diseases. Seek immediate medical care if your child has a fever or their symptoms are worse over time. Again, symptoms might include decreased appetite, feeling tired, fever, high blood pressure, itchy skin, nausea or vomiting, shortness of breath, trouble concentrating, weakness, weight loss, or stunted growth. Symptoms can vary from child to child depending on the cause of the kidney disease. So, what are some of the complications of pediatric kidney disease? Complications of kidney disease in children may include anemia, cardiovascular disease or heart disease, electrolyte imbalances in the blood, especially potassium, growth problems, especially shorter than average height, high blood pressure, hypertension, infection, metabolic acidosis, mineral and bone disorder, cognitive issues, urinary incontinence, growth problems. Frequently in these children, they may be shorter than average, experience delayed growth, anemia, high blood pressure, weak bones that are more than likely to break, electrolyte imbalances, too much or too little potassium or phosphorus in the blood, infections, urinary tract infections that can lead to sepsis, as we said, cardiovascular disease, cognitive issues, poor nutrition, skin changes, dryness or itching, nerve damage, damage to the nerves in the arms or legs. Kidney disease occurs when the kidneys aren't filtering waste properly. So this can lead to a buildup of toxin and wastes in the blood. Kidney disease can also affect children's lives in other ways, causing problems related to behavior, relationships, and self-esteem. Children with CKD may have difficulty concentrating and learning, may develop language and motor skills more slowly than their peers. Parents or guardians may want to learn more about ways to care for a child with kidney disease. So, how does kidney disease in children differ from kidney disease in adults? And the first thing that I saw over and over again is that you can't consider children to be small adults when it comes to renal care. Children are not small adults. They have unique issues that need to be taken care of. Pediatric kidney disease differs from adult kidney disease primarily in the causes with children more likely to experience, including congenital abnormalities of the kidneys and urinary tract, abbreviated as capital CAKUT, as a leading cause where adults often develop kidney disease due to diabetes, high blood pressure, or congenital issues. The impact of kidney disease on a child's growth and development require unique management strategies compared to adults with kidney disease. Dialysis considerations are likewise unique. Children may require different dialysis modalities depending upon their age and size. A lot of children are on peritoneal dialysis. This is sometimes preferred with younger children. There are rare diseases that you see in children that you don't necessarily see in adults. HUS, hemorrhagic uremic syndrome, is a blood condition that can occur when small blood vessels become damaged and inflamed. This damage can cause clots to form in the vessels all throughout the bodies, and these clots can damage the kidneys and other organs. HUS is a rare disease, HUS, that affects the kidneys and the blood clotting system. It's mostly common in children under 5 years of age. Alport syndrome. Alport syndrome is a rare genetic disorder that damages the kidney's tiny blood vessels, causing progressive kidney function loss. It's named after the South African doctor Arthur Cecil Alport, and it affects roughly 1 in 5 to 10,000 children. The condition is caused by genetic mutations in the COL4A3, A4, and A5 genes, which affect the formation of collagen 4, a protein found in the kidneys, the ears, and the eyes. Autosomal recessive polycystic kidney disease. Come on, Jim, that's your own disease. Autosomal recessive polycystic kidney disease, or ARPKD, is a rare genetic disorder characterized by the developments of numerous fluid-filled cysts in both kidneys, leading to progressive kidney dysfunction and potential liver complications. It is caused by mutations in the PKHD1 gene, and it is inherited in an autosomal recessive manner. ARPKD is a rare genetic disorder. It affects 1 in 20,000 children. Idiopathic nephrotic syndrome, INS, is a kidney disease that occurs when the filtering units in the kidneys are damaged. It's the most common type of nephrotic syndrome in children. Vasculitis. Vasculitis is a rare disease that causes inflammation in the blood vessels. It is an umbrella term for a group of conditions that can affect arteries, veins, and capillaries. What causes vasculitis? This comes from the immune system when it mistakenly attacks healthy blood vessels. The cause is unknown. There are some others. Bartter syndrome. Bartter syndrome is a rare genetic kidney disorder that causes the body to lose too many minerals, particularly salt, in the urine. It is characterized by salt reabsorption in the kidneys, leading to imbalances in electrolytes and fluids. Symptoms can appear before birth, during infancy, or in the early childhood. Bartter syndrome disrupts the body's balance of potassium, sodium, chloride, and other molecules. Gilman syndrome, Gitelman syndrome, is a rare genetic disorder that causes an imbalance of electrolytes in the body, especially low levels of potassium, calcium, and magnesium. It is a kidney condition that causes a loss of sodium or salt in the kidneys. The symptoms and severity of the disorder can vary greatly from one person to another and can range from moderate to severe. Neurogenic diabetes insipidus, NDI, is a rare disease that causes the body to produce too much urine, resulting in dehydration. It occurs when the kidneys don't respond to antidiuretic hormone, or ADH, also known as vasopressin. NDI is a disorder in which the defect in the small tubes or tubules in the kidneys cause a person to pass a large amount of urine and lose too much water. Liddle's syndrome, Liddle', is a rare genetic disorder that causes high blood pressure or hypertension. It's also known as Sutter hyperdosuturism. Wow. Renal tubular acidosis, or RTA, is a medical condition where the kidneys fail to properly remove acids from the blood, leading to an abnormally high level of acid in the bloodstream, known as acidosis, due to a malfunction in the kidney tubules responsible for urine filtration. This can result in various complications, including kidney stones and bone issues if left untreated. And finally, Dent's disease. Dent's is a disease that is a rare chronic kidney disorder that causes kidney stones, protein in the urine, and calcium deposits in the kidneys. It is caused by a mutation in the CLCN5 or OCRL1 genes on the X chromosome. It is a renal tubular disorder characterized by manifestations of proximal tubular dysfunction, including low molecular weight proteinuria and progressive renal failure. So what causes kidney disease in children? Congenital abnormalities that we have seen, these include kidney and bladder malformations such as obstructions or reflux. Dysplastic kidneys, these kidneys are not formed properly and can't function normally. Problems with infections. Kidney infections, these can cause kidney disease. HUS, as we mentioned earlier. Genetic diseases like cystinosis, a rare genetic condition that causes a buildup of cysteine in the cells. Other causes include trauma or injury, physical trauma to the kidneys, urinary tract blockages. Blockages in the urinary tract can prevent blood from reaching the kidneys. Medications, some medications cause kidney problems. Systemic diseases, other diseases that affect the body that can cause kidney disease in children. And the aforementioned acute kidney injury, or AKI. AKI is when the kidneys suddenly stop working. This can be caused by infections, blood flow disruption, surgery, or exposure to toxic substances. So how common is kidney disease in children? Kidney disease in children is relatively uncommon, affecting 15 to 75 cases per million in children. However, the problem is that it has very serious consequences, including kidney failure and cardiovascular disease. Causes include congenital abnormalities. The most common cause of kidney disease in children is a birth defect, such as posterior urethral valve defect. Urinary tract infections, frequent urinary tract infections or UTIs can lead to kidney disease. Family diseases like polycystic kidney disease runs in the family. HUS, as we've mentioned before. Lupus, systematic lupus erythematosus is a common cause of kidney failure in teenagers. Risk factors, sex. Male children are more likely to develop kidney disease than female children. In terms of race, Black children in North America are more likely to develop kidney disease than white children. Complications include end-stage renal disease, cardiovascular disease, mineral bone disorder, and poor nutrition. So, how do we diagnose kidney disease in children? Kidney disease in children is diagnosed through a physical exam, medical history, and a series of tests. A physical exam, the doctor will examine the child for signs of kidney disease. Medical history, the doctor will ask about the child's health history and symptoms. Tests include blood tests to check kidney function, blood cell count and electrolyte levels, urine tests to check for protein and blood in the urine, imaging tests use sound waves or x-rays to create images of kidney and urinary tract, ultrasound, a painless test that uses sound waves to create images of the kidneys. A CT scan uses x-rays to create 3D images of the kidneys and bladder. X-ray can show kidney stones and other physical characteristics of the kidney. A kidney biopsy, where you take a small sample of kidney tissue, it's removed and examined under a microscope. Genetic tests looking for specific gene mutations. A doctor may refer a suspected kidney disease patient to a pediatric nephrologist, a doctor who specializes in kidney disease for children. So, how do we treat kidney disease in children? Kidney disease in children is treated with a combination of medication, diet changes, sometimes dialysis, or a kidney transplant. The treatment depends upon the type and severity and the cause of kidney disease, as well as the child's tolerance for different therapies. So medications, what are we talking about? Antibiotics treat infections that may be causing kidney damage with antibiotics. Diuretics to increase urine output and help the kidneys get rid of excess fluids. Antihypertensions to control blood pressure by relaxing blood vessels. Growth, bone density, and anemia medications help with growth, prevent bone density loss, and treat anemia. Diet changes, including choosing vegetables and fruits that are lower in potassium, balancing protein intake, encouraging liquids to help keep the kidneys working, and to limit liquids where kidney disease is more advanced. Dialysis, of course, a machine that filters waste and extra fluids from the blood, may be needed for a short time in acute kidney injury or for chronic kidney injury in the late stages. Kidney transplant. A healthy kidney from a living or deceased donor replaces one of the child's kidneys. Children who receive a kidney transplant can live full and normal lives. Other treatments include surgery to correct blockage in the urinary tract and vaccines to create infections. So, how do we treat complications of kidney disease in children? Complications of kidney disease in children can be treated with medications, dialysis, surgery, and dietary changes. The treatment plan depends upon the child's age, the stage of the disease, and the child's symptoms. So, medications, that would include blood pressure medications, ACE inhibitors, ARBs to reduce blood pressure and protein loss, diuretics to remove excess fluid from the blood and to reduce swelling and lower blood pressure. Anemia treatments include iron supplements to help the body produce more red blood cells. Bone health treatments, phosphate binders, and active vitamin D to help improve bone development and growth. Antibiotics to fight infections. Growth hormone therapy or injections of man-made growth hormones to help children reach a normal height. Dialysis, a procedure that filters waste from the blood, can be done in a hospital or a dialysis center or frequently at home. Surgery would include a kidney transplant to replace a diseased kidney with a healthy one from a living deceased donor, or surgery to correct birth defects or urinary tract obstructions. Dietary changes. A licensed dietitian may help to demonstrate the best nutrition for your child. So, how do professionals treat kidney failure in children? Treatment for kidney failure in pediatric patients primarily involves managing the underlying cause, dietary modifications, medications, and in severe cases, dialysis or a kidney transplant, with the latter often being considered the best long-term option for children with end-stage renal disease to improve their quality of life. This may include preemptive transplant or dialysis. Preemptive transplant, this is a transplant before dialysis. So what are the key aspects of treatment? Medications, depending upon the cause and severity of kidney failure, they may include antihypertensive drugs to manage high blood pressure, diuretics, medicine to treat anemia, phosphate binders to control phosphorus levels in the blood, calcium supplements to maintain proper bone health, dietary modifications or a specialized diet tailored to the child's needs, maybe focusing on fluid restriction depending on the level of kidney function, protein restriction to manage waste product buildup, sodium and potassium control to manage electrolyte imbalances, phosphorus restriction to prevent bone complications, dialysis when kidney function is severely impaired to filter waste products from the blood. This serves as a temporary measure until, of course, the transplant can be performed. Hemodialysis, blood is filtered through a machine outside of the body. Peritoneal dialysis, a solution is installed in the abdominal cavity to filter waste. And of course, the kidney transplant, considered the optimal treatment for most children with end-stage kidney disease, where a healthy kidney from a donor is transplanted into the child. So what are some of the important considerations? Early diagnosis and intervention are important. Early detection of kidney disease in children is critical to manage the condition effectively. Normally, a multidisciplinary approach is taken. A team of specialists, including nephrologists, pediatric surgeons, dietitians, and social workers, may be involved in managing a child with kidney failure. Growth monitoring. Children with kidney disease may experience growth delays requiring close monitoring and potential interventions like growth hormone therapy. Psychological support addressing the emotional and social impact of kidney disease on the child and their family can be important. So this raises a question: can kidney disease in children be prevented. Researchers have not found a way to prevent childhood kidney disease, but getting treatment early and managing the complications can help delay or prevent your child's kidney disease from getting worse. There is no way to prevent all types of kidney disease in children, but there are things you can do to help reduce the risk. For example, genetic diseases. Some kidney diseases are genetic and can't be prevented. Examples would include Alport's, polycystic kidney disease, and cystinosis. Treatment can help manage these diseases, however, and protect your child's kidney. This can be done through lifestyle habits, teaching your child healthy habits like eating well, getting enough exercise, drinking enough water, to help your child manage stress through activities like medication or yoga. Make sure that your child takes medications as prescribed and gets regular checkups. Other factors include antenatal immunizations and diagnosis can help prevent kidney disease in children. Postnatal screening for posternia, hypertension, and dyslipidemia can help prevent kidney disease. Preventing obesity can help prevent kidney failure. Early treatment and management can help delay or prevent kidney disease from getting worse. So, how do we deal with mental health issues due to stress and low self-esteem? Pediatric kidney patients often experience significant mental health issues like depression, anxiety, and low self-esteem due to the stress of managing their chronic kidney disease condition, including frequent medical procedures, limitations in daily activities, physical appearance changes, and the potential burden they feel on their families, leading to a decreased sense of control and self-worth. Key mental health issue concerns in kidney patients include depression. This is the most prevalent medical health issue in children with chronic kidney disease, often stemming from feelings of isolation, loss of independence, body image concerns, dialysis treatments, or medical intervention. Anxiety. Children with CKD may experience a significant anxiety related to medical procedures, potential complications, and uncertainty surrounding their health. Low self-esteem, the physical limitations and dependence on the medical treatments can lead to feelings of inadequacy and a negative self-worth, particularly in adolescence. Social isolation, missing school or social activities due to medical appointments can lead to feelings of isolation and difficulty in maintaining friendships. Body image issues, changes in appearance such as growth restrictions or viable medical devices can contribute to negative body image perceptions. Factors contributing to mental health challenges in kidney patients include chronic illness burdens. The ongoing nature of chronic kidney disease requires constant monitoring, medications, and adherence, and dietary restrictions, which can be stressful to children. Medical procedure, frequent dialysis treatment, surgery, biopsies can be physically and emotionally taxing. Parental stress. Parents of children with CKD may experience significant stress and worry, which can impact the child's emotional well-being. Developmental challenges, stress of managing a chronic illness can interfere with normal development milestones and social interactions. So, how do we support mental health in pediatric kidney patients? Well, you do that through early screening and intervention, regular access for children with CKD for mental health concerns that provide timely access to mental health professionals. Psychotherapy, cognitive behavioral therapy can be particularly effective in addressing negative thoughts and behaviors associated with CKD. Family therapy involving family and therapy sessions can help address communication issues and provide support for caregivers. Peer support group, connecting children with other children facing similar challenges, can foster a sense of belonging and understanding. Education and awareness, educating children and their family about CKD and its potential impact on mental health can help manage expectations and reduce stress. Collaboration between medical and mental health teams A coordinated approach between nephrologists and mental health professionals is crucial for providing comprehensive care to kidney patients. So, what can I do to keep my child's kidney health? What can I do to keep his kidneys or her kidneys healthy? To keep your child's kidneys healthy, focus on promoting a balanced diet with plenty of fruits and vegetables, ensuring they drink enough water to stay hydrated, encouraging regular physical activity, limiting salt intake, avoiding excessive sugar, making sure they take their medications as prescribed by their doctor, while monitoring for any potential side effects. Consult your physician's healthcare provider for specific guidance based on their individual needs. So some key points to remember: hydration. Encourage your child to drink plenty of water throughout the day to prevent dehydration, which can strain the kidneys. Diet. Fruit and vegetables. Include a variety of fresh fruits and vegetables in their diet because they are rich in nutrients that support kidney health. Limit salt. Reduce the amount of added salt in their meals to minimize pressure on the kidneys. Moderate protein. Ensure a balanced protein intake, avoiding excessive amounts which can put stress on the kidneys. Sugar control. Limit sugary drinks and snacks to prevent blood sugar spikes that can impact kidney function. Exercise. Regular physical activity helps to maintain healthy blood pressure and overall kidney function. Medication. Always follow your doctor's instructions regarding medication. Inform them about potential side effects. Regular checkups. Schedule regular checkups with your child's doctor to monitor kidney health and catch any potential issues early. Important considerations: be mindful of family history. If you or other family members have a history of kidney disease, my hands are up. Discuss additional preventative measures with your child's doctor. Avoid smoking. Discourage smoking as it can significantly harm kidney health. Monitor for symptoms. Pay attention to potential sign of kidney problems like frequent urination, swelling in the hands or feet, blood in the urine, and fatigue. I want to talk to you a little bit about clinical trials for kidneys, for children with kidney disease. Clinical trials for children with kidney disease are studies that evaluate new ways to prevent, detect, or treat kidney disease. These trials can help improve the quality of life for children with kidney disease. Some clinical trials for children with kidney disease include chronic kidney disease in children, the CKID study. This is an ongoing study that involves children with mild to moderate kidney disease. The study includes physical exams, blood and urine tests, cognitive development tests. The study's goal is to identify risk factors for kidney function decline and how kidney function decline affects cardiovascular disease, growth, failure, and neurocognitive function. Preserving kidney function in children with chronic kidney disease, abbreviated all caps, PRESERVE, PRESERVE. This 3-year study evaluates blood pressure management and urine protein in children with chronic kidney disease. The ferric citrate and chronic kidney disease in children study. This is a 12-month study that assesses the effects of ferric citrate therapy on changes in TACT of the FGF23 levels in children ages 6 to 18. What organizations conduct clinical trials for children with kidney disease? Here are a few. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, conducts support for clinical trials in kidney diseases. The Children's Hospital of Philadelphia, or CHOPS, abbreviated CHOP, conducts clinical trials for kidney diseases, including the CKID study and PRESERVE study. The Johns Hopkins Child Center conducts research on clinical care and outcomes for children with chronic kidney disease. Some clinical trials may pay for meals, travel, and housing. So there are some interesting clinical trials going on if you are are in need of something like that. By the way, before I forget, if you go to my personal Facebook page, Jim Myers, Myers, this broadcast is pinned at the top of that page. If you go to the comments, I'm in the process of writing a blog, and all of my footnotes are contained in the comments. So if there are particular things that we're discussing tonight that you want to look up, you can find them there in the footnotes to the broadcast. So let's talk a little bit about the transition from pediatric kidney disease to adult kidney disease. The transition from pediatric kidney disease to adult kidney disease refers to the process of transferring a young patient with chronic kidney disease, or CKD, from a pediatric nephrologist to an adult nephrologist, from pediatric dialysis to adult dialysis, usually occurring around the ages of 18, and involves a comprehensive plan to educate the patient on self-management, to build independence in their healthcare decisions, and to ensure smooth continuity of care as they mature into adulthood. This transition is crucial as it can be a complex process due to the developmental changes occurring during adolescence and the need for increased responsibility in managing one's own health. So what are the key aspects of this transition process? Early planning. Ideally, the transition process should begin well before reaching adulthood, allowing time for gradual education and preparation. A multidisciplinary team, a team including pediatric and adult nephrologists, social workers, nurses, and transplant coordinators, should collaborate to address the patient's medical, psychological, and social needs. Patient education, very important. Thorough education on their specific kidney disease, medication management, dietary restrictions, potential complications, and self-monitoring techniques is vital. Developmentally appropriate approach. The transition process should consider the patient's maturity level and the ability to take on increasing responsibility for their health. Joint clinic visits, meetings with both pediatric and adult nephrologists, can facilitate a smooth handoff and address any concerns. Assessment and readiness, evaluating the patient's understanding of their condition and their ability to adhere to treatment plans and coping mechanisms is important before fully transitioning to adult care. So what are some of the challenges in transition? Psychological impact. Adolescence can be a challenging time, and the added responsibility of maintaining a chronic illness can lead to anxiety, depression, or feelings of isolation. Lack of knowledge. Some young adults may not fully understand their condition or the implications of their treatment options. Discontinuity in care. Transitioning to a new healthcare provider and system can lead to gaps in care if proper coordination is not established. Insurance complexities. The insurance guys are always there someplace, right? Navigating changes in insurance coverage can be difficult for young adults transitioning from or to adult health care. Overall, successful transition from pediatric to adult care requires a coordinated effort between healthcare providers, patients, and families to ensure that young adults with kidney disease receive optimal care and are equipped to manage their health independently as they move into adulthood. So, what conclusions can we draw from our discussion tonight? Pediatric kidney patients deserve a vibrant childhood. The joy of playing with friends, the ability to participate in and benefit from education, and the opportunity to build self-esteem and achieve aspirations are all important aspects of a child's life. As it stands currently, the reality of living with advanced pediatric kidney disease prevents too many children with CKD from realizing these ideals. hopefully this will continue to change in the future. So I hope tonight, if nothing else, we raised a little awareness about pediatric kidney disease and child kidney patients, and a little knowledge about the fact. Of course, I will be creating an instant replay of this broadcast. I will post it to all of my groups where I'm an administrator, and I will post it to the groups where I have permission, and I will seek permission from some other child kidney groups to post this broadcast. So if you missed the broadcast, you can check out the replay. Please share the broadcast with people that you think might have an interest in this, or are pediatric parents, or pediatric kidney patients that might show an interest or are old enough to comprehend what's going on. Our next broadcast is next week. I think that's the 24th. I got down here the 17th, but is that today? That's today, isn't it? With our friend Kevin Lewis. Hopefully Kevin will be ready. If he's not ready, I've got someone else lined up ready to go. And I just wanted to say thank you for sticking with me throughout this broadcast, and I'm looking forward to your feedback. Let me know what you think, and I will see you again next week.